Welcome to the Kelly File, everyone. I'm Megyn Kelly, live from the world headquarters of Fox News in New York City. Tonight.
New fallout tonight on the story of the 6-year-old suspended from school for sexual harassment.
I need no one kissed on the hand.
We'll investigate claims that little Hunter's punishment can be traced back to the Department of Education. He beat out Miley Cyrus, Ted Cruz, and Kathleen Sebelius, to name a few. Tonight, why Pope Francis is the Person of the Year. And is this the end of Santa Claus? We'll detail the new push to replace the jolly old man with a white beard.
Merry Christmas!
Tonight on the Kelly File.
Breaking tonight, a Kelly File exclusive. We are getting our first look at urgent new warnings from some physicians that Obamacare may end up putting your neighborhood doctor's office completely out of business. Doctors' offices across the country are learning just what exactly they are going to get paid or reimbursed by the feds going forward, in Medicare payments in particular. And some physicians have gone so far as to warn patients that they may not be able to keep the practice going. Dr. Doug Weiser is president of the National Spine and Pain Centers, which is the largest private pain management practice in the country. Dr. Weiser, good to see you. I want to tell the audience up front, I know you and of your practice because my ex-husband happens to be one of your partners. And I've received your email and your particular warning after you saw what the feds are reimbursing you for your practice and your procedures, which include some very fancy things like sticking needles in people's spines. Tell us what the cuts are and why you're objecting.
Thanks, Megan, for having us. Basically put, Medicare is looking for ways to save some money on physician reimbursements. And we are working collaboratively with CMS to try to make some recommended cuts responsibly that still allow patients access to care. And in our centers, we offer a more cost-effective alternative to hospital care, including office procedure suites and ambulatory surgery centers that allow us to perform sophisticated, minimally invasive spine procedures. And you don't have to go to the hospital.
You can go down the road, go see your doctor, and the next thing you know, you're getting a needle in your spine, you're getting concrete in your spine. You guys do all sorts of crazy stuff, but you keep people out of the hospital. But tell us about the cuts and why you claim they're so dire.
Well, Medicare has proposed cuts that, on average, come out to about 24%, but in particular, pain management can range as high as 58% for basic epidurals, for herniated discs or spinal stenosis, when people have sciatica or leg pain related to a nerve compression. And that's really not sustainable at the office setting. We're already providing care, just over cost, and 58% cut over and above the mandated electronic medical records and the cost of staying in business will really force a lot of us, nearly 40% of pain providers who work in the office setting, to consider whether or not that's viable going forward.
Why is there an incentive? Because I know you say you reached out to your patients and said, contact your congressman, object to this, because this is going to force some doctors out of business. And in your letter, you say they are trying to push doctors who are in private practice out of private practice and patients over to the hospital setting. Why would the law want to do that? Why would the government want to do that?
It's difficult to really ascertain the motive, but one can't help but be skeptical that the goal here is a nationalized system. On the one hand, the government says that they want to reduce cost of health care. We offer the lowest form of care for painful spinal conditions, and yet they cut us the deepest as opposed to our hospital systems that have a much more expensive overhead and facility fee associated with what we do. So the question that begs to be answered is whether or not hospital lobbyists are still working behind the scenes with congressional leaders, and that's what's forcing the hand, or more likely that there's just a generalized push towards a nationalized system like Canada or England, and this will force doctors to either sell to the hospital or go out of business. And once we get down to a single operating system of a hospital employing all doctors, that's when we get closer to a government-run healthcare system.
How, to your critics, is pain management, I know, is one of the few specialties that still gets decent reimbursement rates from Medicare, but that's now being cut. But some of the examples I know, you give lumbar epidurals, so that's correct me if I'm wrong, that's the low back, sticking the needle in, and then the cervical epidurals, which is higher. Give us an example of the rates that have now been cut for you, just so the audience has a feel.
Yeah, just as an example, for cervical injections that were averaging somewhere around $250 in 2013, In 2014, the suggestion is $117. And in the low back, similar, like $247 reduced to $215. And again, those are 51 to 58% cuts. That's really not sustainable given our overheads. I mean, we're not capturing any fee for running a facility typically in our office. We do have surgical centers in some of our states, but that fee pales in comparison to what the hospital would recoup for their overhead.
Yeah, wow. And I know the spinal stimulation procedure got cut by thousands and thousands of dollars. So we'll see where this goes. Dr. Weiser, good to see you.
Thanks for having me, Megan.
All the best to you. I mean, that's just the first round. You know, the numbers are coming out now to these doctors of what they're going to get reimbursed. And you're hearing some of them say it's just, you know, they're shocked because once Medicare cuts, private practice tends to follow. Insurance reimbursements. Well, we just got new numbers today on Obamacare enrollment. Roughly 360,000 signed up for private insurance so far, though no word on how many actually have paid for their policies. So that 360,000 number may be irrelevant. One of the new enrollees is Republican Florida Senator Marco Rubio. We will speak with him about his experience as we today get reports that the exchange built for lawmakers and their staff is encountering serious problems. Well, earlier today on Capitol Hill, Health and Human Services Secretary Kathleen Sebelius faced a grilling on the troubled healthcare.gov rollout, and things got tense when lawmakers tried to ask her about all of the people seeing big premium hikes. Watch this.
But you are telling you're telling us that those who just shop are enrolled.
I have told you, sir, who is enrolled.
Okay, that's why we're frustrated because we just don't get the truth out of it. You cannot say, as you had numerous times, that these preventative care services are quote unquote free of charge, can you?
They are free to the consumer, yes, sir.
They are not. There is no free lunch, Madam Secretary.
If you have preventive care and prevent a more costly hospital stay, cancer.
All right, I got it.
Down the line, that cost
we're just going to agree to disagree.
Lowers the premium, doesn't raise it.
It's like talking to the Republic of Korea or something.
Joining me now, Michigan Congressman Fred Upton, who's a Republican and chairman of the House Energy and Commerce Committee. He was in that hearing today. Mr. Chairman, good to see you. And so I want to zero in on that one point that we heard in the middle of that exchange about Kathleen Sebelius maintaining that these new services, contraception coverage and so on, are free, that they are free to the consumer. The point the Congressman seemed to be raising, we didn't get all the soundbite in there, was that there's been an admission by some state administrators that the price for that has been built into the premiums, some of which are raised, are higher than they were.
Look, we know that nothing is free, right? And we are hearing from each of us, each member of Congress, I got to believe, across the country, certainly I am, we're hearing from hundreds and hundreds of our constituents who are being forced out of their plan. In fact, the statistics are pretty clear that we've got more people that are being told that they've lost their plan than are able to sign up for this new president's health care bill. And for those that are now signed up or newly enrolled, many of them are finding that their premium is skyrocketing.
She refused to admit that. She would not admit that premiums are going up. And the architects of this law maintain that while your premium may go higher, the subsidies are going to make it lower.
No. In fact, the premiums are going higher. For so many people, the deductibles are going up in the thousands of dollars as well. People are not able to keep the health care plan that they want. We know that all these individual plans, for me in Michigan, we've got almost 250,000 Michiganders are losing their individual health care plan. And we know that by a year from now, tens of millions, perhaps as many as 80 to 90 million Americans with employer-based health care are going to lose their plans as well.
How do you get anywhere when you're talking to her? I mean, the congressman taking some heat for saying talking to her is like talking to North Korea. But when she refuses to acknowledge that there is no such thing as a free lunch, is that free contraception coverage? It's not free.
No, you know what almost happens with all these hearings? We only could have her for 2 hours today. So shortly after noon, she had to leave. We almost have more questions from her appearance than we had time to ask, and some members weren't able to ask any questions at all.
Well, what about this?
This was just a subcommittee.
What about this? Because she came out and said today that she believes strongly in the need for accountability. So today she's announcing that she's going to ask the Inspector General to review the development of healthcare.gov. I mean, I ask you, Mr. Chairman, shouldn't she already know the answer to that? She is the Health and Human Services Secretary.
It's still Fred. In September, she looked us in the eye and said that they were ready to go, ready to launch, things are ready. I want to say on September 30th, she said the goal for success would be 7 million enrollees by the end of March. So here we are in mid-December. We're learning that it's about 350,000. And in fact, but that isn't complete, because until people are paid, or have actually paid their premium,
right,
there's nobody on board, and they're not going to know those numbers until the end of the month. So what happens on January 4th, February 15th? Someone goes to the ER, someone goes to the doctor like you just talked to, and they think that they may be enrolled. Who knows if they've paid or not? They've expanded Medicaid in the, more than 100,000 enrollees that were not expected. They're forcing these folks onto the states. The states don't know if they're eligible or not. I mean, this is one giant mess.
Wow. Well, we'll look forward to that Inspector General report. Mr. Chairman, Fred, thank you for being here.